Mr. Kuhn, it's nice to meet you. I'm a new member of the committee, so I haven't had a chance to talk with you before.
Nice
Nick
to meet you.
Mulvaney from South Carolina. And what I want to spend most of my time on is just following up on some of the things you've said to some of my colleagues on both sides, starting with Mr. Meadows from North Carolina. He asked you why you had not been able to provide the breakout data that he had sought on the enrollment numbers. And your answer was that you want to make sure the numbers were vetted and verified. And I think Mr. Cummings actually asked you similar questions. You said we'll make sure the numbers were checked and double-checked and triple-checked. So let me ask you a couple questions about that. Is that the same standard that you use, sir, before you release information to the public?
Yes.
It's the same standard that you use before you release information to the media?
Yes.
All right. So the information that came out a couple weeks ago that said that somebody had miscounted folks who had enrolled in dental coverage, did that come out of your office?
As I recall that issue, that was an issue related to enrollment of last year.
Right.
Where standalone dental membership was included with the health care.
Correct.
Yeah.
And did that data come from your office?
Yes, it did.
Had that been vetted, verified, checked, double-checked, and triple-checked before it was released to the press?
Our commitment in communicating data,
Hasn't
Mr. Vice
changed.
Chair,
Yeah, I got you. Okay.
is to make sure that it is verified.
Fair enough. And it wasn't in that particular circumstance, was it? It was wrong.
Mr. Chairman?
And there's nothing wrong with admitting you're wrong, Mr. Kuhn. I've been wrong. I mean, it's only 11 o'clock, and I've been wrong 3 or 4 times today. The data that came out on the enrollment data was wrong, wasn't it?
Sir, what I would like to communicate to you and to the committee is not only our commitment to verification.
I get it.
But
that's fine, Mr.
But
I promise not to beat up on you if you promise not to filibuster the time. That's fine.
But we have put in new safeguards to
I know a
avoid
lot of
that
people
type
who
of problem.
listen, I work with politicians. I have a lot of people who admit they're wrong sometimes. Don't worry about it. Let me ask you this: the process. How long does it take to answer Mr. Meadows' question?
Well, Mr. Meadows had several questions.
Okay. Let me do it this way. If I ask you the question, listen, Mr. Kuhn, can you tell me how many people were auto-enrolled in a different program last year? How long should it take you to answer that question?
It's a seemingly simple question. It's a very complex question.
Again, I recognize it, and I simply ask you, how long should it take you to be able to get, if the White House called you and asked you for that, how long would it take you to get that number to them on a vetted, verified, check, triple-check basis?
I'm unsure.
Okay. How many people were, let's go a different way at this. How many people were unenrolled or uncovered by insurance, health insurance, before the Affordable Care Act came under law?
That's one of the issues one of your colleagues asked that I need to follow up on.
The President said it was roughly 30 million people. Was he roughly correct? And he said that, I think, in 2009 in a joint session of Congress.
I suspect he is.
Okay, so roughly 30 million people were uninsured at the outset of the Affordable Care Act, before the Affordable Care Act became law. Fair enough. How many people in the country are uninsured today?
Sir, that also came up from one of your colleagues. It's a good question that I'm coming back to you with an answer.
Okay, can you give me an educated estimate within, say, 1 million people?
Sir, I need to get back to you with a more precise response.
Can you give me an estimate within 5 million people?
I want to get back to you with a precise response.
About 10?
I want to get back to you.
You don't have any idea how many people are uninsured in this nation?
Sir, I've learned with information it's important to be precise.
I get you. Let me ask this. You got a question earlier from, I believe, Mr. Heiss regarding supplemental funds that were available to your organization.
Right.
Who knows whether or not that is a true statement, whether or not you received supplemental funds? You said you don't. You said you weren't familiar with it. Is that correct?
That's correct.
So who in your office would know that answer?
I need to explore that.
Are you aware, Mr. Cunahan, that if you were the CEO of a publicly traded corporation that was subject to the Sarbanes-Oxley requirements, that many of the answers that you're giving today could get you thrown in jail?
Sir, I'm unfamiliar with the Sarbanes-Oxley.
Have you told anybody in your office not to provide you with information?
I have not.
Okay. Has anybody in the White House told you not to seek information regarding any of the information this committee has sought?
No.
Okay. Do you feel like you have faithfully undertaken to collect the information this committee is seeking from you?
I believe I've got a commitment, and it is my responsibility to provide that information I also believe,
Actually, that may be the most stunning answer you've given, Mr. Coonahan, because that was an easy yes. I asked you if you thought you had faithfully undertaken to give us the information. You should have said yes, and you didn't. My time, however, has expired, so I'm going to recognize now the chair.